The PICU looks after the sickest children in all of the hospital. Around 30 to 40% of the patients on the ICU are children with heart disease, and particularly newborn babies that have had open heart surgery and children with severe heart failure are some of the most vulnerable patients in all of medicine, so they need to be on the intensive care unit for very close observation. We know that from studies from around the world that around 5% of children with heart disease, if they need intensive care, around 5% of them will suffer cardiac arrest. But there's been some evidence in recent years that actually up to a third of these arrests could be prevented.
It's important to reduce cardiac arrests because around 1 in 2 or 1 in 3 children who have a cardiac arrest will unfortunately die on PICU or CICU. But also it also has an impact on quality of life, so the development of children in the future, their ability potentially to walk, talk, go to school normally and things like that. So it's not just survival but also, you know, their quality of life.
We've focused in the past mainly on how we treat arrest and how good we are at resuscitation and being prepared to resuscitate, but this shifts the focus much earlier to identifying proactively the children who are at risk and making preparations so that if they deteriorate we can act rapidly and hopefully prevent the arrest.
It's my responsibility to talk to the nurses and the medics as well who are looking after these patients and educate them about the importance of the measures we're taking. So some of the measures that we introduced are a document which we call an HRP sheet, and that's a document that we fill out at the beginning of each ward round, so in the morning and then in the evening, where we look at the patient's parameters, their heart rate, their blood pressure and other parameters, and set really strict guidance about what we want to see and when to escalate further. Then we have a dilute strength of adrenaline available at the bed space, and that will prevent a patient from going into a full cardiac arrest. And we like to highlight our patients in CAP-QI as well with a sign, and that just makes it clear to everybody that these babies and children are at high risk. Families have reacted really positively to the project. It's really great to go and speak to the families and tell them about the project and what it's doing and how it's helping to support that baby, and they feel reassured by it.
Lewis's condition is called hyperplastic left heart syndrome. It was diagnosed when I was pregnant in one of our scans. A big shock because it happens to 3 babies out of 10,000 babies born, so it's extremely rare. He was born early. He came at 35 plus 6 weeks. That's 5 pounds 2, which is too small. So they said they couldn't offer us any surgical route. So offered us palliative care, and I said no, I want a second opinion. And they came to Birmingham. Lewis has had 2 surgeries and 1 chest closure. It's been great because of how delicate Lewis is and his heart condition. We cannot afford a cardiac arrest. So what Sue's done is came and explained the project, which is amazing. And that actually worked for Lewis. He was going out of range. We didn't know what was going on. His heart rate went sky high. Pressed the panic button, they all came rushing in. But because he was a CAP-QI patient, that saved his life because he went into peri-arrest and they had the adrenaline ready for what he needed. CAP-QI saved his life.
We're absolutely delighted with the results of the project so far. We've seen a 40% reduction in cardiac arrest rate, so that equates to around 1 child per month less having a cardiac arrest than in the year before we started the project. So in terms of the future of the project, I think hopefully we've really embedded the principles of the project onto our unit and for our patients, and really the priority is making things sustainable in the future. So I think ensuring that we've got ongoing education, ongoing champions for the project, ongoing analysis of results and outcomes so that we can improve care for patients and parents. We couldn't say thank you enough to the charity for supporting this project. The role that Sue's done with the funding from the charity has really sort of helped embed the education rollout of support for nursing staff and doctors, and I think without that we wouldn't have seen the success that we have seen.
Without this role, we wouldn't be where we are now. It's been amazing and people have been so generous. So I'm really, really grateful for every single donation that's helped us with this.